This is Dr. Bharadwaz. I'm a homeopathic doctor from Fidicus Homeopathy. Today we will be looking into the topic of cervical spondylosis. So we will look deeply into it. What are the causes for it? What are the signs? What are the symptoms? What is the pathology of it? What is the conventional treatment for it? And what is the homeopathic treatment? How better is homeopathy or how bad is homeopathy in treating the cervical spondylosis? So what is cervical spondylosis? Cervical spondylosis is the degenerative condition of a lower cervical region. So neck is called cervical region. We have vertebra here. We have 7 vertebra. In the lower part of the neck, we will have degenerative changes. So that occurs above the age of 40. This is normally age-related disease. There are many reasons for it, but it normally occurs for the people who are aged above 40. So what are the clinical features? The main feature for the cervical spondylosis is pain in neck. You will have pain in neck in the first stage. When there is compression on the nerves coming out of the cervical region, we will have radiating pain. That is one of the major symptoms. And sometimes you will have the weakness of upper limb, paresthesia or clumsy fingers. So these are the main symptoms of cervical spondylosis. But in severe conditions, there are other symptoms where you will be having paralysis as well, in very severe cases. What are the signs? You will have tenderness over the neck movement is restricted, and you will have sensory loss over the upper limb. So the sensory loss will be there, motor, you will have some weakness on the hands, and also you will have abnormal tendon reflexes in the upper limb. So what are the investigations? Normally in early stages we can go with X-ray. X-ray reveals diminished spaces between 2 vertebra, and also there will be lipping of vertebra, and also there are osteophytes in X-ray. In severe cases where the spinal cord is involved, you may have to take a MRI, or when there is a radiating pain, or when the nerves is involved, you may need sometimes CT scan. So we will look into the normal structure. So you can see here, this is a vertebra, this is a healthy vertebra. In between 2 vertebra there are discs, in these we call as intervertebral disc, and in between there is a foramen, there is a ring-like structure, there is a ring-like structure in each vertebra that we call as a foramen. In that foramen you can see in this yellow, this is the spinal cord running, and you can see here these are the small nerves coming out of the spinal cord at every place. Okay, so this is the normal structure. Now we will look into the pathology, how these structures are going to change and impact the nerves and causes pain in future slides. What is the function of these joints? They provide movement. These are related to age. The degenerative changes occur due to progressing of we will now understand the pathology. Degenerative changes of vertebral disc, fibrosis which may lead to nerve root compression, edges of the vertebral body hypertrophy, and this is called lipping, degeneration of neurocentral joints. These are the pathological changes. You can see here there is a pressure on nerve root. This is a nerve root coming out of the spinal cord, and there is a pressure. So this pressure causes radiating pain on the upper limb. So you can see this disc, the degenerative changes in the disc is pressing this nerve, compressing this nerve, and this may lead to pain and other nerve related symptoms in the upper limbs. So this is when nerve root is compressed. So what happens when spinal cord is compressed? You can see this is a normal joint, normal vertebra. You can see here the vertebra degenerative changes going and pressing the spinal cord, and in this case you will have severe symptoms, okay, like paralysis of lower limb, the part below the neck. So this is a very complicated thing, and this is not common. Now what is the conventional treatment? The conventional treatment is with painkillers and with surgery. These are the options we have, and also physiotherapy. Now we will look into homeopathy treatment, how homeopathy is going to help you in this particular case in any stage. So stage 1, stage 2 or stage 3, how homeopathy is going to help you. So this age related change is due to mental stress, physical stress and physiological stress. There are excellent medicines in homeopathy where it can counter the effects of physical stress, physiological stress and mental stress, that we call as constitutional treatment. We attack this disease in several directions. One of the directions is constitutional treatment. So the cause for these degenerative changes can be counteracted by constitutional treatment. Apart from this, when there are local symptoms, we can treat locally. There the nerve is damaged or the bone is damaged, cartilage is damaged. Based on the signs and symptoms, we can treat the patient. We can prevent the further occurrence of the disease, further progress of the disease. For example, if you are going to stage 1 to stage 2 in 10 years, so we can take it to 20 years to 30 years. We can prevent the progress of the disease. once you have the disease, we can cure it. Sometimes we can regenerate the bone, we can regenerate the disc. There are evidences that the bone is regenerated in early stages when we go with the homeopathic treatment. In severe cases, we can relieve the pain, we can relieve the symptoms, and make you happy. You have to remember, all these things are done without side effects. That is an important thing. So as this is a long-term treatment, it is not you take for 1 week or 1 month. You have to take the medicines over a period of time. So you have to select the system of medicine or medicines which do not have side effects. If you are already on the treatment, you are on severe cases, if you are already on the allopathic treatment or any other treatment, so we can decrease the side effects caused by those medicines or increase the efficiency of those medicines, or we can have the cumulative effect that the medicine from that system of medicine and homeopathic medicine will have cumulative effect and also additional effect. So what we can do is, once you start on the homeopathic medicines, so we can slowly wean off the medicines of other systems, so that you will be depending only on homeopathic medicines where there are no side effects. You have to remember, while in the homeopathic medicine there are side effects, but these side effects are very rare. And also, final thing, every case cannot be successful, but with us you have the best chance for success in treatment of cervical spondylosis. You can have online consulting. When you have online consulting, we can ship the medicines to your doorsteps, and also you can come to our clinic in person. Thank you.